The Ebola outbreak is hitting places in West Africa hard. Hundreds are dead, hundreds more are at risk or are dying from the disease. Ebola is scary. It spreads quickly. It kills more than half of the people it infects, and there is no cure. But there is another side to the story, the fact that the outbreak has very little chance of getting into the United States, and if it does, we are well equipped to contain it. I'm here right now in studio with Karla Black, the Kent County Health Department's Emergency Preparedness Coordinator, to get a better perspective on the threat to the United States and, of course, here in West Michigan. Karla, thank you for joining us.
Hi.
Really appreciate it. Why is it so difficult to get a hold of this Ebola?
Overall, I mean, based on what resources they have over in Africa, it's really hard to contain it. They don't have the healthcare resources that we do, and so it just makes it incredibly hard to isolate everyone and use the proper protective equipment to deal with each of these patients.
Let's talk a little bit closer to home. How is the Ebola virus spread?
So it's kind of a complicated situation. You can have Ebola virus in your system, but you can't actually spread it until you're exhibiting symptoms. And once you're exhibiting symptoms, somebody would have to come in contact with your bodily fluids to get it.
Okay, so bodily fluids is the key with that. Any possibility of the general public catching Ebola from like a sneeze or a cough, something like that?
Technically, yes, you could. However, the person has to have been in the region affected by Ebola. They actually have to be exhibiting symptoms. And so if they did sneeze or cough, they could spread it. But at this point, it's highly unlikely that we would have just the general public exposed to Ebola.
Why do we not have to worry about it in the United States?
It kind of goes back to our robust public health and healthcare systems. Public health every day is charged with disease surveillance, making sure that the public is safe and has good health. But then also our healthcare system is very good at noticing diseases, and so they can make sure that the disease is monitored and cared for properly.
Is there anything we should do in preparation for Ebola or any other disease that comes into the United States that we're not familiar with?
At this point in time, again, it's public health. We're monitoring all those diseases, but right now there is notification out through airlines and things like that. So if somebody does get sick on an airplane that has come from these areas, we do have isolation and quarantine stations throughout the United States, and there are protocols of how they would handle somebody coming to the United States like that.
Yeah, and we were talking a little bit earlier about this, and why is it that Ebola has no cure at this point? We make a lot of strides in medicine, and it's just surprising to hear about something that just has no cure whatsoever.
It's really hard to study the Ebola virus, amazingly enough. I mean, to actually be able to study the virus itself, you would have to have a biosafety level 4 containment system, so that means having to have the full moon suit and everything like that to study the actual virus itself. So it's very hard to work with. So we haven't just made as many strides as we would like, but I know scientists are definitely working on this.
And possibly a vaccine, too.
Yes, they're looking at doing vaccine trials starting possibly in September.
Okay, Karla Black with the Kent County Health Department. We really appreciate you coming in today, shedding some light on Ebola. Thank you.
Thank you for having me.